A colonoscopy is a vital medical procedure that allows doctors to examine the inside of your colon and rectum for potential health problems, including ulcers, inflammation, bleeding, polyps, and tumors. It's an essential tool for diagnosing conditions early, particularly colon cancer, and is performed using a specialized device called a colonoscope. This device is a long, thin, and flexible tube equipped with a light and a high-definition video camera at its tip, which provides a clear view of the colon's interior on a monitor in real time. The procedure begins with the colonoscope being gently inserted through the anus into the rectum and carefully navigated through the entire colon, reaching the cecum, the starting point of the large intestine, and often extending to the terminal ileum, the end of the small intestine. The colonoscope is a multifunctional tool equipped not only with a camera and light, but also channels for flushing water or air to clean the colon's lining and improve visibility. These channels also allow doctors to insert instruments, such as tiny forceps or wire loops, to remove polyps or take biopsies of suspicious tissue for further examination. Before the procedure, patients are offered sedation to ensure comfort and relaxation. During the colonoscopy, the doctor may gently press on the abdomen or ask the patient to change positions to help guide the scope through the natural curves of the colon. The colonoscope inflates the colon slightly by releasing air, making it easier to examine the lining. While this can cause a sensation of pressure or mild cramping, it can be alleviated with slow, deep breaths. The colonoscope is slowly withdrawn as the doctor carefully examines the colon's lining for abnormalities. If polyps or suspicious areas are found, they are typically removed during the procedure using a technique called a snare polypectomy. This involves encircling the polyp with a thin wire loop and applying an electric current to detach it. The removed polyp is then retrieved through the colonoscope for laboratory testing. Most polyps are benign, but can sometimes develop into cancer if not removed. A colonoscopy generally takes 30 to 60 minutes and is performed by a gastroenterologist in a hospital or clinic. After the procedure, patients are monitored in a recovery room until the sedation wears off. While some mild gas or cramping may occur, this typically resolves quickly. Due to the sedation, patients will need a family member or friend to drive them home and should avoid strenuous activities for the remainder of the day. The results of the colonoscopy are usually shared with the patient before they leave the facility. This procedure is not only diagnostic, but also preventative, as removing polyps reduces the risk of developing colon cancer. Colon cancer, one of the most common cancers globally, often develops without noticeable symptoms in its early stages. However, there are subtle warning signs your body might give. Recognizing these signs and acting promptly can dramatically improve survival rates, as early-stage colon cancer is highly treatable. Stay informed and proactive about your health, as this awareness could make all the difference. Let's take a closer look at the 8 most common warning signs of colon cancer. While these symptoms don't always indicate cancer, they are your body's way of signaling that something may be wrong and should be promptly evaluated by a healthcare professional. Early detection is crucial, as colon cancer is more treatable in its initial stages. 1. Changes in bowel habits. One of the earliest and most common warning signs of colon cancer is a noticeable and persistent change in bowel habits. This might include prolonged diarrhea, unresolved constipation, or a sudden alteration in the consistency or shape of your stool, such as narrower stools. These changes could signal a partial blockage in the colon caused by a tumor. Occasional irregularities in bowel movements can occur due to diet or stress, but if they persist for more than a few weeks, it's essential to seek medical attention. 2. Blood in stool. Seeing blood in your stool, whether bright red streaks or darker tar-like stools, known as melena, is always a red flag. Tumors in the colon can bleed, leading to this symptom. While other conditions like hemorrhoids or anal fissures can also cause blood in stool, you should never assume it's something minor. A healthcare professional can perform tests to identify the exact cause. 3. Persistent abdominal pain or cramping. Unexplained abdominal pain or cramping can also be a sign of colon cancer. This discomfort may present as bloating, gas, or a continuous ache in the stomach area. A growing tumor can obstruct the colon, making it difficult for stool to pass, which may lead to pain. If this discomfort becomes frequent, severe, or doesn't resolve with over-the-counter treatments, consult a doctor promptly. 4. Sudden, unintentional weight loss. Significant weight loss without changes to your diet or exercise routine can be an alarming sign. Colon cancer cells consume a considerable amount of your body's energy. Additionally, the disease can interfere with your body's ability to absorb nutrients from food, leading to unexplained weight loss. This may also be accompanied by a loss of appetite and general fatigue. 5. Chronic fatigue or weakness. Feeling constantly tired or weak, even after adequate rest, is another possible symptom. This kind of fatigue isn't temporary. It's a deep and persistent exhaustion that might be caused by anemia due to slow, chronic blood loss from the colon. Anemia reduces oxygen in your bloodstream, leaving you feeling drained, lightheaded, or unable to concentrate. 6. Tenesmus, incomplete bowel movements. Do you feel like you need to go to the bathroom even after just finishing a bowel movement? This sensation, called tenesmus, may be caused by a tumor in the rectum or lower colon. A tumor can partially block stool passage, giving you the sensation of needing to go even when your bowel is empty. Persistent tenesmus should not be ignored. 7. Gas, bloating, and fullness. While occasional gas and bloating are common, chronic or unusually severe episodes could signal a deeper problem. Colon cancer can create blockages in the digestive tract, trapping gas and causing bloating. You might also feel full even after eating small amounts of food. If these symptoms persist or are accompanied by changes in bowel habits or abdominal pain, seek medical advice. 8. Rectal bleeding or discharge. Bright red blood or discharge from the rectum is another warning sign. This may occur with or without bowel movements. Although rectal bleeding is often associated with conditions like hemorrhoids, persistent or unexplained bleeding should always be evaluated by a healthcare professional to rule out more serious issues, including colon cancer. Why you should act on these signs. Each of these symptoms, especially when persistent or combined, is your body's way of signaling a potential problem. Recognizing and addressing them early can make a significant difference in the outcome. If you experience any of these warning signs, don't delay. Schedule a visit with your healthcare provider for further evaluation. Early diagnosis can save lives. Colon cancer is a disease that can affect anyone, but certain factors significantly increase the risk of developing it. Understanding these risks is critical in taking proactive measures to protect your health. Here's a detailed look at the factors that may elevate your chances of developing colon cancer. 1. Age. The likelihood of developing colon cancer increases with age, particularly after the age of 50. While cases in younger individuals are on the rise, the majority of diagnoses still occur in people over 50. This is due to the accumulation of genetic mutations over time, which can lead to cancerous changes in the colon. 2. Family history. If you have a family history of colon cancer or colon polyps, especially in close relatives like parents or siblings, your risk of developing the disease is higher. Genetic predispositions, such as hereditary non-polyposis colorectal cancer, HNPCC, or familial adenomatous polyposis, FAP, can also increase your susceptibility. If colon cancer runs in your family, you may need to begin screenings earlier than the general population. 3. Diet. Diet plays a critical role in colon cancer risk. Consuming large amounts of red meat, e.g., beef, lamb, or pork, and processed meats, like sausages, hot dogs, and deli meats, has been linked to a higher risk of colon cancer. These foods can produce carcinogenic compounds during digestion, especially when cooked at high temperatures. Conversely, a diet low in fiber, such as fruits, vegetables, and whole grains, fails to promote healthy digestion and regular bowel movements, which can contribute to cancer risk. Fourth, lifestyle factors. Unhealthy lifestyle choices can significantly increase your risk of colon cancer. Smoking introduces carcinogens into the bloodstream, which can affect colon health. Heavy alcohol consumption can damage the lining of the colon and impair the body's ability to repair damaged DNA. Obesity increases the risk of developing colon cancer and tends to lead to more aggressive cases of the disease. Lack of exercise reduces overall digestive health and may increase inflammation, contributing to cancer development. Fifth, medical conditions. Chronic inflammatory bowel diseases, such as Crohn's disease and ulcerative colitis, elevate the risk of colon cancer due to ongoing inflammation in the colon. These conditions can cause damage to the intestinal lining over time, making the tissue more susceptible to cancerous changes. Awareness of these risk factors can empower you to make lifestyle and healthcare changes that significantly reduce your likelihood of developing colon cancer. Routine screenings. Colon cancer is preventable and treatable when detected early. Screenings, like colonoscopies, are essential for catching the disease in its precancerous or early stages. Colonoscopies allow doctors to identify and remove polyps, growths that can develop into cancer if left untreated. Early screening for high-risk groups. While most individuals should begin screenings at age 45, those with a family history or other risk factors should start earlier and discuss a tailored screening plan with their doctor. Healthy lifestyle choices. Adopting a balanced diet rich in fruits, vegetables, and whole grains, engaging in regular physical activity, maintaining a healthy weight, quitting smoking, and moderating alcohol consumption can all lower your risk. Colon cancer often develops silently, but recognizing potential warning signs early can make a significant difference. Persistent changes in bowel habits, e.g., diarrhea, constipation, or narrower stools. Blood in the stool, whether bright red or dark and tar-like. Abdominal pain or cramping that doesn't resolve. Unintentional weight loss, or a persistent feeling of fatigue. While these symptoms don't always indicate cancer, they should never be ignored, especially if they persist for more than a few weeks or worsen over time. The importance of early detection. Colon cancer is one of the most preventable cancers. When detected early, it is highly treatable, with survival rates significantly improving. By prioritizing regular screenings, paying attention to symptoms, and maintaining a healthy lifestyle, you can take charge of your health and dramatically lower your risk. If you experience any concerning symptoms, don't delay. Schedule a consultation with your doctor. Staying vigilant and informed is your best defense against colon cancer.